Because of the people behind it, more than anything else. I've seen the quality and the approach to the way they do things. There's a certain thoroughness, there's a certain standard, almost that's the standard of excellence that you can obviously see the group of people are trying to attain. And that's what's caught my attention. Also, having spoken with Anoop in the past and seen, we've discussed things that we feel are missing from most of these two-day courses that are going on, where you walk away and you're sort of thinking, well, you've got the mechanics of how to put brackets onto teeth, but you still don't know why you're doing it and exactly what you're doing.
I want to get into more cosmetic work, and this is a very minimally invasive way of providing good quality, good standard of dentistry, and giving my patients what they want.
There are limitations to removable appliances, and this added to the amount of treatments that I could carry out.
I've enjoyed it. I've done different types of general practitioner orthodontics, I mean, in the past, not massive amounts, but this one has left me feeling a lot more confident in that I actually understand why I'm doing what I'm doing. There's a big emphasis on assessment of the patient, proper records, diagnosis. So going forward, just looking at the cases that I've brought along, I feel I'm going to be far more confident. And also the fact that there's this mentorship behind you. It's UK based, and yeah, that's really what's. And I'm really pleased that I've done it.
The course has been great. It's been very well organised, and Anoop's done a great job. And it really does tell you a lot of the things, the basics that us as general dentists need to know, from very simple things about orthodontic diagnosis, how orthodontists go about it, what equipment to use, and it simplifies all those things. Does it in a great way, very simple to understand, and provides you with the resources that you need to equip yourself to get started in this field.
I really enjoyed the course. Not having had any previous training, I wondered how I was going to cope with, taking in all that information, processing it, digesting it. But Anoop's been very good. The course was geared towards novices like myself. So yeah, I've enjoyed it very much.
Professional, there is a great emphasis on safety, patient care. It's great, very good, very professional. Pleased.
Anoop is not just knowledgeable, he's entertaining, very easy to ask questions of. He's a good teacher. He's classic teacher. He's a teacher, so and that's what I really like about him.
Anoop did a great job. I mean, obviously, I'm a wet-fingered dentist. That's what I do. I like people who treat patients every day, and you can tell from that he's treated lots of these patients. He knows that not everything's gone perfectly, and he's willing to share that with you. And that now we're moving forward to a new and better way. And the great thing about a teacher is one who's willing to share their experience with you, whether that's good, bad, or indifferent. And Anoop's certainly been doing that with us.
He's made it sound interesting, exciting. I can't wait. Can't wait to get going on my first case.
Good speaker, experienced speaker. I think he's got a wide knowledge on a lot of areas of dentistry, and he was quite generous with his information. And good help, very good help. And I think he'll be certainly an asset to helping in the future with cases that are a little bit more tricky.
I'd rather not name them, but I will say that none of them go into the depth that this one has gone into. Going back and reflecting, quite often you get caught up in the excitement and maybe charisma of a speaker, and you go away thinking you're going to do wonderful things, and there's quite a bit of pressure sometimes to buy a number of cases only available at the course. There's none of that going on here. So for me, I just feel this is the way it should be done.
I found that this is similar to the Inman course. I think they're both professional outfits. The Invisalign was a long time ago. I think things have changed in orthodontics, but it was. I'm pleased with my initial knowledge, which needs to be grown upon, and the forum I'll be able to use. But no, I've been impressed.
I would absolutely recommend this course. Tim, for me, to recommend something, I'm not just going to say it lightly. I'd rather say I'm not going to say anything. But if I'm going to say I recommend something, I genuinely recommend it for all the right reasons. Number one, you're learning to do things the right way. Your patient is safe. If you're doing things this way, you're doing a proper assessment, you're doing proper records, you know what you're going to do. You've got to understand, before you can come to a prescription for the patient's treatment, you've got to understand why you're getting there. You've got mentors behind you watching every step that you're taking. I highly recommend it. Highly recommend it.
I definitely recommend it. I think it's a great way. I don't think 2 days is never enough time. You know, there's so much to learn, but it's a great start on the way forward.
Most definitely, I would recommend the course. In terms of litigation, it's something that has put me off getting into anterior alignment orthodontics previously. So with that in mind, with the forum and everything, I think it's safe for the patient and it's safe for us.
I'd recommend this course because it's not about speed and getting the money out of the patient. It's about safety and development.
Excellent.
Professional.
Stimulating.
Brilliant.